Thank you for joining us, David Hertel, in for Elias. Well, robot nurses are coming to the rescue at the CIUSSS Hospital. That's in Valleyfield. So now there's a virtual care hospital unit being set up there, and patients who are treated are cared remotely by nurses from the Jewish General Hospital. Tell us more. I'm joined now by Lawrence Rosenberg, CEO of the CIUSSS West Central Montreal. Lawrence, thank you for joining us this morning.
Good morning. My pleasure.
So tell me about these robot nurses, because I saw the pictures in the La Presse report about this. So you have a nurse at the CIUSSS Hospital, but she's kind of wearing like a 3D optical, a virtual reality mask thing. So tell me how this all works.
It's actually layered care, if I could put it that way. And the nurses aren't robots, obviously.
But it was an interesting title.
It was an interesting title, yes. It was a very well-written article and very factual. But the nurses are real. They're humans. And it isn't really a virtual hospital per se, because CIUSSS Hospital in Valleyfield is actually a real hospital.
Of course.
The staff there consists of auxiliary nurses, or LPNs, PADs.
I'm sorry, LPNs, PADs. Please amplify.
Yeah, so LPNs are licensed practical nurses. So they're not RNs. They're perhaps one step below a certified RN. So they have a limited number of things that they're able to do, unlike an RN or a baccalaureate nurse. The unit there is also staffed with orderlies and with physicians who are on staff in CIUSSS. So it is a real hospital unit. What they're missing are RNs, or baccalaureate nurses, fully certified nurses, and that's where we stepped in. Offering to extend our virtual care program, our hospital at home program, to create actually a hospital in a hospital program remotely that's managed by our nurses at the Jewish General Hospital.
So how does it work? There's some sort of monitoring device that is placed on the patient. Did I see that in the report as well?
Right. So this is what I mean by layered care. So one layer of the care is actually these monitors, or these monitoring devices from a company called BioBeats, that are patches that are taped to a patient's chest wall, which enables us to collect real-time vital signs information via the internet back into our command center at the Jewish General in real time, monitoring these patients around the clock in a way that is probably better than they would be monitored in a real hospital, because in a real hospital ward, the nurses don't go in every 5 minutes monitoring vital signs, but we collect that information remotely at the Jewish and can flag the real people in CIUSSS as to whether or not something needs to be further investigated or not. So that's one layer of the care. The second layer of the care actually is more traditional video interaction using a Microsoft product called Teams, which allows our nurses to interact directly with the patients visually and by speaking to them over an internet connection. The other layer of care, which you referred to at the beginning, the so-called robot nurses, is the use of the Microsoft HoloLens to create a augmented reality or an extended reality environment for those auxiliary nurses, or LPNs, that are working in CIUSSS. They put on these extended reality goggles, and what they see, what they feel, actually gets transmitted back to our nurses in our command center at the Jewish General Hospital, giving them a completely immersive experience as if they were there, which enables them to much better help and assist the nursing assistants in their day-to-day care of those patients.
This is fascinating. So I get the advantage for the CIUSSS that is going through staffing shortages, but on your end at the Jewish General, I mean, do you have the staff to do that?
Well, a couple of years ago, we did set up our virtual care program, which we have been scaling up ever since and growing. It's probably the fastest growing program we have at the moment. So yes, we do have the staff, and the ministry has actually been very supportive with respect to making sure this plays out in an appropriate and high quality way.
So how long has this been going on at Le Surroi?
About 2 weeks.
And so far, I mean, any results, any data? I know it's maybe too soon, but I mean, how is it shaping up?
It looks like it's going to be a real, a true success. We started with, I think, 4 patients a week and a half ago. We went up to 8 to 10 patients last week. This week, we're planning to go up to a maximum of 20. Which was the limit that we both agreed would be practical and reasonable. And really, everybody is thrilled, especially the patients.
Really?
The patients are especially thrilled.
So this could be a real solution, in part, of the staffing challenge that we have right now.
It could be, absolutely.
Sorry, go ahead.
I was just going to say, this is really the first use of this layered approach to monitoring that's been implemented in the country, never mind just Quebec. This really is a game changer.
And so how does this work in terms of costs? I mean, you have your budgetary challenges. I mean, this is definitely not free. This state-of-the-art equipment, staff. How does this work with a hospital that is definitely not in your CIUSSS region? I mean, what's the mechanics of this?
That's a great question, and we're still working through this, or I should say that the management of CIUSSS Montréal West is working through this with the ministry. But what I can tell you, based on the experience we've garnered over the last 2 years at the Jewish General with our own hospital at home program, the cost is less than having patients in hospital.
Wow.
The number of staff required to man it is much less than the staff that would be required in hospital. And the patient satisfaction is much higher than it would be if they were sitting in the hospital instead of in their living rooms at home. So this is a win-win all the way around.
Let's just hope the bureaucrats in Quebec City don't screw it up. Thank you so much, Mr. Rosenberg, for coming on this morning.
Thank you.
Lawrence Rosenberg, CEO of the CIUSSS West Central Montreal. That's great news. Real exciting development. Let's hope it works.